came about in 1965. The government realized at that point that as folks were retiring at 65, and typically back then folks did work until age 65, that they had no health insurance options at that point. So they came out with a Medicare program to give people the opportunity to get some type of health coverage as they were retiring from their employer and turning 65, and that's how the program came about. There is a government agency that oversees these programs. It's called the Centers for Medicare and Medicaid Services, or CMS for short. So as you're looking through any materials you see about Medicare, you may see CMS referenced, and that's just a government agency that oversees all these programs. Next screen, please. So there's really two parts to Medicare when the time comes for people to sign up for with the government, and that's Medicare Part A and Medicare Part B as in boy. Part C and Part D, which we'll talk about in a few minutes, those are some of the insurance options people have as they're going on Medicare, and Part C and Part D are all done with private insurance. Next screen, please. So in terms of Medicare Part A, typically, folks will sign up for Part A as they're turning age 65, or if they've decided to work past age 65, then coming off the employer plan and they work for an employer that had more than 20 employees, they will want to make sure they're signing up for Part A at that point. If someone has already taken their Social Security check as they're turning age 65, the government is going to automatically enroll you in Medicare Part A and Part B. And assuming you're okay with that, that's all you'll need to do with the government. But if you have other options for your health insurance at that point, whether you're covered under an employer plan or a spouse's employer plan, and the employer has more than 20 employees, you are not required to stay with Medicare Part B, which we'll talk about in a few minutes. You'll have the option to suspend Part B at that point and just go with the employer plan, and then you'll sign up for Part B as you're coming off the employer plan or retiring down the line. So let's first talk about Medicare Part A. Part A is going to cover someone's inpatient needs. And typically the government is not charging folks a monthly premium for Part A because as long as someone has their 40 quarters in that they've contributed to Social Security over their working career, or their spouse has their 40 quarters in, there is no charge for Part A. But if I talk to folks that may have 38 or 39 quarters in, I always strongly encourage them to get those extra couple quarters in so they do qualify to pay no premium at all. Because you can see by the second bullet point, the premium for Part A can be as high as $447 a month. So if you're close to getting those 40 quarters in, it may make sense to stick it out, get those 40 quarters in so you don't have to pay a monthly premium for Part A. And again, for folks that are under age 65, if you are disabled and you've received Social Security benefits for disability for 24 months, the government's going to enroll you automatically in Medicare Part A and Part B. Next point, please. Next screen, please.
Yes, it's not cooperating. Give me one moment.
That's all right, a little sticky. So Part A is going to cover someone's inpatient needs. So some of the major benefits covered under Medicare Part A would be hospitalization. And the way it works under Medicare Part A is the government is going to charge a deductible. The first night someone's admitted to the hospital, the deductible changes every year. This year, the Part A hospital deductible is $1,632. Now, that $1,632 deductible would actually cover someone for all the way up to 60, and that's 60, all the way up to 60 nights in the hospital. So if someone's in the hospital for 60 nights, that's working out to about $26, $27 a night. Not a bad deal, but I'm sure most of you realize it's rare that someone's in the hospital more than a couple of nights unless they're awfully sick. One thing to remember about the hospital deductible on a Medicare is it's not an annual deductible. It's actually going to reset once someone comes home from the hospital for more than 60 days. So once there's a 60-day break in hospitalization, if someone has to go back in the hospital at that point, even if it's the same year they were in it earlier, they're going to pay a brand new deductible. If someone should go back in the hospital within 60 days of coming home, they'll be covered under that previous deductible. Now, also be aware for folks that may have a long stay in the hospital, the government is going to start to charge a daily copayment. So for someone that's still in the hospital day 60, and this was certainly happening with COVID, from night 61 through 90 in the hospital, this year Medicare is charging $408 a night. Pretty big number. If someone's still in the hospital day 90, you would actually have an additional 60 nights that Medicare could cover someone in the hospital, but the co-payments for those 60 nights is going to be $816 a night. And the key thing to remember about Medicare Part A and Medicare Part B on its own is that Medicare itself does not come with an out-of-pocket limit. So people that just have Medicare A and B without any additional insurance have unlimited exposure. And that's one reason I'm not a big fan of someone just having Medicare when the time comes. Next screen, please. There are some other benefits that are covered under Medicare Part A. And again, Part A is going to cover your inpatient coverage. So Part A will cover blood, hospice care, limited home health care. One of the other major benefits under Part A is skilled nursing facility care, but that's covered just for rehab. Remember, Medicare is not going to cover someone for custodial care. So if someone needs rehab care and they're going to go into a skilled nursing or rehab facility, Medicare will cover them for rehab for up to 100 days. The first 20 days should be covered in full. Days 21 through 100, the copayment again is expensive. It's $204 a day. So again, this is another reason with that large copays, if someone has a long stay in a rehab facility, they want to make sure they have some type of insurance to help cover that. Next screen, please. Now, so that's Medicare Part A. And again, Part A is going to cover someone's inpatient needs. And remember, the government's typically not charging folks a premium for Part A. Now, the other part I mentioned when folks are signing up for Medicare is you're also going to need to sign up for Medicare Part B. And again, if you're turning 65, you have no other option for health insurance, or you're paying for health insurance on your own at that point, or you work for a company that has fewer than 20 employees, you are going to be required to sign up for Medicare and also hold on to Medicare Part A and Part B. The time to sign up, if you're turning age 65, you can start to sign up for Medicare 3 months before the month you turn 65. The easiest way to do it would be to have a user ID and password established on the Social Security website. You can log in there and sign yourself up for Medicare Part A and Part B, or you can go down to the local Social Security office and sign yourself up in person. So Medicare gives folks 3 months before the month they're turning 65 to get all signed up for Medicare A and B. Once someone does that, it takes the government a couple weeks to process that application and mail out your Medicare card. And the reason we need the Medicare card is that's going to have your Medicare number on it, which the insurance companies are going to need when the time comes for you to pick your insurance. Now, when you're turning age 65, Medicare A and B is typically going to start the first of the month that someone turns age 65. So even if your birthday is the 25th of the month, your Medicare is going to start on the first of that month. Now, the only thing to remember is if you are actually born on the first of a month, believe it or not, they're going to start your Medicare a month earlier. So for those that are born on the first of the month, your Medicare will start a month earlier. Anyone else, the Medicare is going to start the first of the month they turn age 65. Now, if you miss that enrollment period of signing up as you're turning age 65 and you are not covered under an employer plan, you're kind of locked out to signing up for Medicare Part B until you get to the period that's known as a general enrollment period. So if you miss the time to sign up as you're turning 65, you'll have to wait till the general enrollment period comes around, and that's between January and March of each calendar year. During that period of time, if you don't have Part B, you can sign up for Part B at that point. And the Part B, there's a little update on that screen. The Part B will actually start the first of the month after you signed up for Part B during that general enrollment period. It used to be they started it on July 1st. They've actually changed the rules for this year. So if someone is signing up for Part B during that general enrollment period between January and March, it will start the first of the following month. Now, also be aware that the government is going to charge folks a monthly premium for Part B. The standard rate this year is about $175 a month per person. Now, also be aware, if you're entitled to Medicare, you're turning 65, and you do not have any other kind of health insurance, even through an employer, and you do not sign up for Part B at that point, you will be subject to a lifetime penalty down the line. And that's the second bullet point there. And the way the penalty works is it's going to be a 10% penalty for every 12-month period that you did not sign up for Part B when you were entitled to. And that's 10% of whatever someone's Part B premium is. Now, to the third bullet point, for folks that are going, that may have COBRA as an option. When you retire, you're probably aware of the fact that the employer is typically required to offer you a COBRA benefit, which is a continuation of your current health insurance plan with you paying that full premium, and COBRA can last for up to 18 months. But please be aware that the government does not consider COBRA an employer plan. So if someone has been covered under the employer plan, they have not signed up for Part B, which is totally fine, and they're going on COBRA, you'll need to make sure you sign up for Part B at that point. Otherwise, you may be penalized. Next screen, please. And again, the Part B premium for this year, you'll see on the first bullet point, is $174.70 per month. To Quintara's point earlier that she mentioned, the government has not released what the premium is going to be for next year. Typically, that information will come available sometime during the month of November. The government also does income testing when they're looking to establish someone's Part B premium. And the way the income testing works is they're going to look back at your tax return. So if you're filing an individual return and your modified adjusted gross income exceeded $103,000, or you're filing a joint return and exceeded $206,000, you are going to pay a surcharge for that Part B premium. And we're going to look at that chart in just a second. And the way it works is they're always looking back at your tax return from 2 years ago in any given year. So for this year, Social Security is looking at someone's 2022 return. When we get to January 1st of next year, they'll now look at just the 2023 return. And the number they're looking for is someone's modified adjusted gross income. And that's what they're going to look at in terms of charging someone more than that standard rate. If you are underneath those numbers, then you're just going to pay the standard rate. If you're over those numbers, you will pay more. If you're not taking your Social Security check out, if you're going on Medicare, which is totally fine, the government's going to bill you for Part B. If someone is already receiving their Social Security check as a starting on Medicare, the government will just deduct that monthly Part B premium right out of the check. Next screen, please. And this is the chart that's showing you what someone may pay if they're at a higher income level. Now, again, what this chart is showing you is for folks that are filing a joint return. If you're filing an individual return, just cut that first column numbers in half. So in other words, we're not looking at a 206 hurdle, we're looking at a 103 hurdle. And remember, they're going to surcharge you on top of the standard rate. So if someone had their modified adjusted gross income on the 2022 return with say $220,000, instead of paying the $175 a month that the government's going to bill them for Part B, they'll pay $244.60 plus an additional $12.90 for the Part D surcharge. So they surcharge both the Part B premium and the Part D, which is your prescription drug coverage, is surcharged as well. And you can see looking down the bottom of that chart, for folks that are a higher income of more than $750,000, they're going to pay a total of about $675 a month. So again, those that are making a higher income are certainly paying more into that Medicare program. And remember, this number gets reassessed every year because January 1st of each year, they're going to look at the following year's tax return. So this year, they're looking at the 2022 return. When we get to January 1st of next year, they'll now look at just the 2023 return, and Social Security will make any appropriate adjustments at that point. And this IRMA surcharge chart will also be released in November. So again, these are the numbers for 2024. We have no idea what it's going to look at for next year. Now, one thing to remember, if you're going on Medicare and you're going to be charged a higher rate due to that higher income off of the tax return from 2 years previously, the government does give you the opportunity to appeal these surcharges. But you can only appeal the surcharges if your overall income is indeed going to drop. And what they're looking at when they're looking at the overall income is both earned and unearned income. So if someone is replacing that earned income that they're no longer receiving with unearned income, whether it's capital gains or money's out of the 401k or IRA or a pension, really their overall income is not dropping. But if the overall income is indeed going to drop, you do want to file an appeal because the government will give you the opportunity to waive these surcharges or reduce them. And that way you're not paying as much for Part B as you get started. If you decide you're going to wait and let the government just look at that tax return, remember they won't make that appropriate adjustment until 2 years down the line. because that's when they'll finally look at this year's return. So that's why they give people the opportunity to file the appeal. I always tell folks it doesn't cost a dime to file the appeal. You might as well file it. The worst they can say is no, and then you're going to pay whatever they're going to charge you anyhow. Next screen, please. All right, so Part B is going to cover someone's outpatient needs. So remember, A is inpatient, B is outpatient. So Part B is going to cover services like doctor's appointments, physical therapy, outpatient lab and diagnostic testing like MRIs, CAT scans, someone's blood work. It would cover durable medical equipment like oxygen, a walker, a wheelchair. It also covers outpatient surgery. So the government does have a deductible with Part B. Unlike Part A, it's an annual deductible. And this year, the Part B deductible is $240. So once someone is satisfied their outpatient deductible of $240, the balance of the Part B expenses for the rest of the year, Medicare would cover 80%, and you would be responsible for 20%. So it's an 80-20 plan after the deductible. And again, just like with Part A, there's no limit on someone's 20% exposure on the Part B. So as an example, if someone were to run up, say, $25,000 of outpatient expenses, not that hard to do nowadays, they'd be responsible for 20% of that, or $5,000. Next screen, please. So that's how Medicare A and B works. There are some additional benefits covered under Part B, and all these are going to be covered for zero copay because Medicare considers these preventative, and they want to strongly encourage folks to take advantage of these preventative and screening options. All your immunizations, whether it's a flu shot, COVID shot, shingle shot, all those are covered for zero copay. You can get bone mass measurements every 24 months, cardiovascular screening. Your colonoscopy, if it's preventative, is covered again for zero copay. Diabetes screening is covered. Next screen, please. Glaucoma testing. Your annual mammogram will be covered again if it's preventative. Pap tests and pelvic exams are covered. Prostate cancer screenings are covered as well. And they also have smoking cessation counseling available. Next screen, please. Some of the items also covered under Part B would be your ambulance, limited chiropractic services, diabetic supplies, emergency room, eyeglasses after cataract surgery, and if someone has diabetes, nerve-related damage, or foot exams would also be covered under Part B. Next screen, please. Kidney dialysis, medical nutrition, many of the outpatient mental health services are covered under Part B. Someone needs second surgery opinions, you're also entitled to that with Medicare Part B. Telemedicine is available. We talked about the diagnostic testing and transplant services. Next screen, please. There are some items not covered under Medicare, and this is surprising when I give folks this information, but Medicare does not cover dental. And that's a big hole in Medicare, is you have no dental coverage with Medicare. Some of the types of Medicare Advantage plans, which we'll talk about a little bit later, they may offer someone some limited dental coverage. But if you're looking at Medicare itself, there is no dental coverage with Medicare. Medicare also does not cover hearing aids, which is hard to believe. Also will not cover someone who's traveling outside of the U.S. So if you just have Medicare A and B, you're only covered in the U.S. And Medicare also does not cover an annual physical after the first year, but they do cover a wellness exam each year. Next screen, please. So again, there's a couple different ways you can get your Medicare. When the time comes, you are required to sign up for Medicare A and B with the government. That's all you need to do with the government at that point. To the third bullet point, you have the option, if you want, as you're going on Medicare, to add a program which is called a Medicare supplement or a Medigap plan. The other program we'll talk about in a few minutes is called Medicare Advantage. So let's discuss Medicare supplement a little further. Next screen, please. Again, Medicare Advantage will be the next option we'll talk about in a second. And we'll skip to the next screen. And also we're going to talk about the prescription drug coverage as well. And these are all items you need to make sure you have checked as you're going on Medicare. Next screen. So a Medicare supplement plan, excuse me, works differently by state. And I believe most people on this call are located in Massachusetts. For those that are living outside of Massachusetts, there are different options for Medicare supplement plans than for folks that live in Mass. And the way a Medicare supplement plan is designed, it's designed to cover those deductibles and co-payments we just talked about that come with Medicare Part A and Medicare Part B. Another reason people like supplement plans, in addition to covering those deductibles and copayments, is when someone has a Medicare supplement plan, they do not have to worry about a network. So the supplement plan, someone's going to have total freedom of choice. They're going to have the option to go to any doctor they want anywhere in the country. All they're going to need to do when they call to make the appointment is confirm the doctor takes Medicare. Right now, 98% of them do. So the nice thing about having the supplement plan is whether you're in Massachusetts, down in Florida, or out in California with your plan, you want to see a doctor, you don't even have to ask about the insurance. All you need to do is confirm they take Medicare. Next screen, please. Now, this is the chart of the different types of programs that are available under the Medicare supplement options for those that live outside of Massachusetts. So you'll see there's a wide range of plan options, anywhere from Plan A to Plan N. For those that live in Mass, the equivalent in Massachusetts is Plan G, and in Massachusetts, Plan G is called Supplement Plan 1A. So if you live in Massachusetts, you're looking at a true Medicare supplement plan. Most likely you're looking at Medicare Supplement Plan 1A, which would be the equivalent to Plan G on this page. And anything that is checked means that the supplement plan covers that. So you'll see the only thing that's not checked when we look under the Plan G column is that Part B deductible. So if someone is enrolling in a Medicare supplement plan, the only medical costs they're going to have during the year will be that outpatient deductible, which this year is $240. Once someone has paid that outpatient deductible, everything else covered under Part A, which is all your inpatient coverage, is called covered day one, $1. Everything else covered under Part B, including all doctor visit copays, after that deductible is paid, is also covered at 100%. So when I talk to folks and they ask me for the highest level of medical coverage, the Medicare supplement plan would be the option someone would want to look at. By the way, Medicare supplement plan is also called a Medigap plan. So when you hear Medigap and Medicare supplement, they're talking about the same kind of program. Now, for those on the call that may live outside of Massachusetts, and I help people out all around the country with their options, the two Medicare supplement plans you want to really look at would be Plan G or Plan N. And you can see, again, Plan G is going to cover everything under Medicare A and B except for that Part B deductible. Plan N will cover everything under that except for the Part B deductible. You'll also have a $20 office copay with Plan N and a $50 copay if someone ends up in the emergency room. So because you'll have two additional costs with Plan N, typically the premium for Plan N is a little bit lower than Plan G. So again, when I talk with folks that are living outside of Massachusetts, those are really the two options we look at. Next screen, please. Now, one good thing to remember for folks that live in Massachusetts is you're free to change your plan every year in the fall, and you do not have to worry about pre-existing conditions. So Massachusetts, whether you start with a Medicare supplement plan or the Medicare Advantage plan option, which we're going to talk about in a second, you have the option to change your plan every year in the fall between October 15th and December 7th for the first of the following year. And again, as long as you're a Mass resident, you don't have to worry about pre-existing conditions. So that's the beauty, is every fall you always have the opportunity to reassess your coverage for the following year. And again, if you live in Mass, you can choose whatever you want that's available for that following year. So if you live in a different state, you may have to worry about pre-existing conditions. So depending upon what state someone lives in, we want to make sure you're aware of that there may be pre-existing conditions if you go to change your plan down the line. So let's talk about the other option besides the Medicare supplement option, and this is the Medicare Advantage plan. So again, we're going to choose one or the other. We choose a Medicare supplement plan or we choose a Medicare Advantage plan. You can't have both. But again, you have that opportunity every fall to go back and forth amongst these plans. So a Medicare Advantage plan works very differently than the supplement plan because what's happening when someone has a Medicare Advantage plan is a private insurance company that's going to offer you that plan is now going to take over servicing and administering someone's Medicare Part A and Medicare Part B. And all that simply means is the private insurance company is going to take over paying the doctors, paying the hospitals, settling all the claims on someone's behalf rather than Medicare doing that. And the government says that's worth something to us to have the insurance companies handle that in our place with a Medicare Advantage plan. So we're going to pay that insurance company that's offering that plan about $500 to $600 a month for every month that someone's on that Medicare Advantage plan. So whether someone's using their Medicare Advantage plan or not during the year, the insurance company that's offering that plan is going to get about $500 to $600 a month from the government. So because of that, you'll see as you're looking at these different options that the premiums for the Medicare Advantage plans are generally lower than what they offer the supplement plan. Again, you have to remember that the insurance company is going to get that money monthly from the government, the $500 to $600 per month. Now, other things to be aware of when you're looking at a Medicare Advantage plan is now we're going to be talking about a network plan, either a PPO or an HMO. We'll look at that a little more closely in a second. And Medicare Advantage is allowed to offer you someone some additional benefits that you don't get with Medicare. So we already talked about this briefly before, but many of the Medicare Advantage plans will offer someone a pretty generous dental reimbursement, which is, again, something Medicare doesn't cover. So some of the Advantage plans may reimburse folks $1,000 or $1,500 a year towards their dental costs. Many of the Medicare Advantage plans will offer a small eyewear reimbursement each year. Again, something Medicare doesn't cover. All the Medicare Advantage plans will offer someone a big discount on hearing aids. Again, something Medicare doesn't cover. And many of the Medicare Advantage plans will offer someone a fitness benefit or fitness discount. So those are all reasons why people might choose a Medicare Advantage plan to take advantage of those extra benefits. But there's one more drawback with Medicare Advantage when we're comparing that with a supplement plan, is with the Medicare Advantage plan, you're going to have medical copayment exposure during the year that you don't have with a supplement. So you may pay a lower premium or maybe no premium at all for your Advantage plan, but you need to remember every time you use it medically, you might have a copay. So I'll just give you a couple of quick examples. It could be a $50 copay if someone needs to see a specialist. It could be a $100 copay if someone ends up in the emergency room. It might be a $300 copay for an ambulance. It could be a $250 copay for an MRI. It could be a $400 per night copay the first 5 nights in the hospital. So unlike the supplement plan where you pay a higher premium to get a higher level of coverage, the Medicare Advantage plans may be more pay-as-you-go plan. You may not pay a premium for your plan, but every time you use it medically, you might have a copay. So in terms of who's going to choose what type of plan, I find most folks that choose Medicare supplement plans fall in 2 groups. Either those that have some ongoing medical issues or some medical concerns coming up. It's going to be an easy way for them to budget the medical costs by adding that near 100% coverage on top of the Medicare. And the other group that like the Medicare supplement plan are those who are looking for peace of mind. And everyone to help out, peace of mind's got a different price. But many people certainly tell me, knock on wood, I generally don't use my health insurance much during the year, but I know I'm going to sleep better at night. No, something should crop up and go wherever I want. I don't have to worry about a network, and I'd be covered at close to 100%. So if you're a peace of mind person or you have some medical issues you're concerned about, you may want to strongly consider the supplement option. Again, for folks that are looking at Medicare Advantage, they fall in 2 different groups in the supplement option. Certainly those who are on a fixed income with a premium for the supplement plans will be able to reach for them. They like the lower premium Medicare Advantage option. And the other folks who like Medicare Advantage are those that just don't use a lot of medical services. And especially in Massachusetts, many folks, they may only go to the doctor 2, 3, 4 times a year. They don't have any chronic or ongoing health conditions concerned about, and really they don't feel like they need to pay for a plan like the supplement they're really going to use. So they'd rather pocket the premium dollars they pay for the supplement, choose a 0 premium Medicare Advantage plan, peel off a couple co-payments for their doctor's visits during the year. Now they get the extra benefits like the dental, the vision, the hearing, and the fitness. And then every year in the fall, if they want to reassess and go to the supplement plan, they'll have the option to do so. And again, as long as they live in Massachusetts, they won't have to worry about pre-existing conditions. So when folks call me and say, what's the best plan out there? I'll say it all depends on what's most important to you. Now, 2 other things to be aware of. When you choose a Medicare supplement plan, you have to add a standalone prescription drug plan, which is called Part B. We'll look at that in a couple of minutes. If you have a Medicare Advantage plan as your plan choice, the Part D coverage is all included. Next screen, please. Again, who's entitled to choose a Medicare Advantage plan? You need to have Medicare Part A and Part B, and you need to reside in the plan service area. So for folks that are looking at the different Medicare Advantage plans that are out there, you'll start to notice they vary by county and they vary by state. So again, whatever county you live in, that would be the plans that are available for you on the Medicare Advantage side. they'll cover you wherever you travel, but you have to choose a plan for the county that you reside in. Again, if you're looking to just get a prescription drug plan, all you need to have is Medicare Part A and or Part B. Next page, please. Again, there is some help from many of these state agencies for folks that have very limited incomes. In Massachusetts, it's called Mass Health. In other states, it's your state Medicaid office. So if someone may qualify for some help due to limited income, I strongly recommend they reach out to the state Medicaid office and see what they might qualify for. Next page, please. All right, so let's talk a little about the prescription drug coverage. This is something that came about back in early 2000s. And there's really two options in getting your prescription drug coverage when we're talking about Medicare. If you're choosing a Medicare supplement plan or a Medigap plan, to the first bullet point, we're going to add a standalone prescription drug plan to cover your meds. If you're looking at a Medicare Advantage plan, it's all going to be included with a Medicare Advantage plan. Next screen, please. Okay, so again, if you're looking to add a separate Part D plan, you are going to pay a separate premium for that plan. And you will, if you do not sign up for prescription drug plan as you're turning 65, again, it's a voluntary program, you will be penalized down the line. So you always want to make sure if you're going on Medicare that you're going to have a prescription drug plan, either a standalone plan with a supplement plan, or if you choose the Advantage plan, it will be included. And because you want to make sure, A, you've got prescription drug coverage. If your meds might change during the year, if you get prescribed an expensive med, you want to make sure you have coverage for that. And also you want to avoid any penalty for not signing up for your prescription drug plan. And to the bullet point down towards the bottom, you'll see open enrollment in terms of changing your plans, whether it's a prescription drug plan or a supplement plan or an Advantage plan, is each year between October 15th and December 7th. Next screen, please. Okay, so again, if you're going to choose a Medicare Advantage plan or a supplement plan, remember you'll continue to pay that Part B premium to the government no matter what. That's not going to go away. Next page, please. So again, there are different types of Medicare Advantage plans. One option is a PPO program, and for folks that may or may not be familiar with a PPO is a nice option because you're not required to get a referral from a specialist. And you can still see doctors out of the insurance company's network for maybe a little bit higher copay. So most people like the flexibility of a PPO because they're not required to get a referral. Next page, please. There are some special needs plans available when we're looking at Medicare Advantage plans. And these are plans that are designed for subpopulation of Medicare beneficiaries. So some of the special needs plans are designed for folks that are called dual eligibles. And those are folks that are eligible for Medicaid and Medicare. And those are folks that are typically at the lower end of the income ladder. So if they're at the lower part of the income ladder and they qualify for Medicaid and Medicare, they may want to see if there's a special needs plan available in their area. And if so, that may be a great option for them. There are also some plans that are designed for folks that may have some chronic medical conditions, and those are called chronic care plans. And the way you would enroll in that plan would be if you had one of the chronic care conditions that plan is covering. Some of the plans will cover folks that have diabetes on the chronic care side. Others may be heart issues. And again, the chronic care plans are not offered everywhere. They're only offered in certain counties and certain states. Anyone that chooses a special needs plan, the good news about that is it always includes the prescription drug coverage, so you don't have to worry about that. Next page, please. These programs have kind of gone away, but years ago, one of the other Medicare Advantage plan types, instead of a PPO option, was a private fee-for-service. You probably aren't going to see any of those anymore. But if you do come across a private fee-for-service plan, it's not a network plan. The only thing you have to do is confirm that the doctor will accept the terms and conditions of the plan, and that we can use it at that doctor's office. But again, I don't think you're going to come across too many of these at this point. Next page, please. All right, so again, just to dig a little bit deeper on the prescription drug coverage, the program came about in 2006. Again, it's all provided by private insurers. Again, the only thing you do with the government is sign up for A and B. Everything else is done with private insurance. You can add either a standalone prescription drug plan if you're choosing a supplement or Medigap plan, or it's included with your Medicare Advantage plan. The government does come out what's known as a standard plan design every year. And the prescription drug plans that are offered by the insurance companies are required to be at least as strong as that standard plan design or better. And again, as we looked at that income chart earlier, if you're at a higher income level, you're going to pay also a surcharge for whatever prescription drug plan you choose. Next page, please. So this is the standard plan design. Not every prescription drug plan is going to look like this. And again, this is the 2024 plan design. But many of the Part D plans had a deductible. This year, the deductible was $545. After the deductible was covered, typically on the standard plan design, you're looking at a 25% copay for someone's medications. If they were to reach that coverage gap number, which this year is $5,030 in total drug costs, that would put them into something called the donut hole or the coverage gap. Again, a 25% copay for the medication. And this year, if someone's total drug costs reached $8,000, they'd had no more prescription drug copays for any of their meds. And again, this is a standard design. Not every prescription drug plan you'll see has that design, but this is what the government's putting out as an actuarial blueprint. Next page, please. Again, as I just said, many of the Part D plans will have slightly different setups than what that standard design is. Next page, please. And you'll see if you're starting to look at Part D plans, your medications are going to be on different tiers. Some of the plans have 5 tiers, some have 4 tiers, some have 3 tiers. Typically, the lower the tier number, the lower the copay. So most generic medications, many of the plans are either going to be tier 1 or tier 2. And many times the copays for a tier 1 medication, many of these plans may be a 0 copay. Many times the tier 2 copay might be a $5 copay for a 30-day supply. Most of the plans, if we're looking at a tier 3 or higher medication, you'll have that deductible to cover first, and then you go to the copay for whatever tier someone's medications are on. And please be aware that prescription drug plans can change significantly on a calendar year basis. Next page, please. And again, I talked about this briefly before, but if you don't sign up for a prescription drug plan as you're going on Medicare, you will be subject to a late enrollment penalty when you decide to choose one down the line. And the way the government calculates a penalty is 1% per month for every month you should have signed up for a plan. So if someone waits 30 months after they went on Medicare to finally sign up for a prescription drug plan, they're going to be subject to a 30% penalty. And it's 30% of whatever the government establishes for a national monthly premium benchmark for prescription drug plan. That national benchmark premium this year was about $35 a month. So if someone's paying a 30% penalty, they're paying about $10 a month. And again, that's a lifetime penalty. So if I'm talking to someone that doesn't take any medications, we typically will put them in a lower cost plan as a placeholder, give them the opportunity to change their plan every year in the fall if their medications have changed or they need a plan that's giving them a higher level coverage. And again, the bottom bullet point for folks that are leaving a group health plan, you need to make sure you sign up for your prescription drug coverage within 63 days, otherwise you will be locked out. Next page, please. Now, there are some big changes for the Part D plan for this coming year. And this is due to the Inflation Reduction Act that was passed a year or two ago. First of all, this is a great bullet point, the first one. This year, if someone's prescription drug copays reach $2,000, that's all they're going to pay for the year. In years past, some people can pay $5,000, $10,000 in prescription drug copays. This year, the government's going to limit it, required to, with all the prescription drug plans, to have a $2,000 limit for copays. So because of that, there is no more coverage gap or donut hole to worry about. And the government's also coming out with a new option this year, which is the prescription payment plan, which is going to allow people to spread out the prescription drug copays evenly over a 12-month period. So rather than having to pay that large $590 deductible the first month, they can contact their Part D plan provider, let them know they want to be enrolled in this prescription payment program, and they will even out the prescription drug copays for their meds over that 12-month period. And those are the big changes for this coming year, and that's good news for many folks that are taking prescription drugs. I think that's it. Next screen. Yep. So this is my contact information. I know I went through a lot of information, and as you can tell, there's a lot to it. Really meant more to be just kind of an overview for folks, giving you a feel for some of the programs. I'm happy to take any questions through the chat box, or if anyone wants to sing out with any questions, I'd be happy to address them now.
Stu, I have a couple questions that I got directly in through the chat. First is, are we able to send out this presentation so people can review your slides?
Sure. Yeah, you guys happy to share it.
Okay, great. Second question was related to someone interested in living abroad during retirement. So currently a Massachusetts resident, but thinking of retiring over the border to our friendly neighbors in Canada. How does that work logistically?
Well, once you're no longer a U.S. resident, you can't sign up for Medicare plan because, again, they're based on someone living in the U.S.
Mm-hmm.
So you'd have to pick whatever program Canada offers, and I have no idea what they offer up there.
Okay. I know, and I don't know how much experience there is with this, but I have a relative that was living in Texas and keeps a mailing address there, and then moved to Mexico where there's like a number of expats there, and he kind of bops between, so he gets like normal care in Mexico, but then when there's anything more serious, he's flying to Texas to get anything real done. Is there a way to maintain insurance here? Like, are there any rules around that in terms of retaining a certain level of residency here for healthcare purposes?
Yeah, that's a great question, Guitar. So you can keep the A and B by paying that Part B premium, but in terms of signing up for health insurance, there's a Medicare plan. Again, it's based on where your legal residence is.
Okay.
So if his legal residence is Mexico, which it sounds like it is, even though he retains a mailing address up there, he's kind of locked out from choosing a U.S. Medicare Advantage plan or a Medicare supplement plan.
Okay.
Are there any other questions that you see in the chat?
One thing to remember, I'm sorry, I'll just jump in before I take the next question.
Yeah.
If you choose any type of Medicare plan, a supplement plan, or an Advantage plan, each of these plans are going to give someone emergency care coverage worldwide. So as you're traveling up to 60 days out of the country, you'll get emergency care coverage worldwide with either of the Medicare programs we've discussed here.
Stu, follow up to that. If someone moved out of the country for, let's say, 10 years to enjoy the first part of their retirement and then said that was fun, but now I'm coming back, and they move back to Massachusetts, are they able to rejoin the system? Is there a penalty for having been, out of pocket for 10 years or?
Yeah, great question. So if they continue to pay their Part B premium as they lived abroad, then they're just changing their address and coming back to the U.S. If they didn't pay their Part B premium, I believe the government's going to penalize them for not paying it for that period of time. And then it's going to be a math calculation to see what's going to make sense for them to pay that penalty or not.
So the biggest issue with moving abroad is more so being able to sign up for the Medigap or the Advantage, but you can continue to hold your Part B coverage.
Sure, but again, you're not going to be able to use it outside of the country.
Right. Okay.
Right. So you're going to need to, wherever you live locally, you're going to need to make sure you have some kind of health insurance there.
Right. Got it. Okay.
Yep. I get that question a lot. That's a good question. Well, thank you everyone for joining us on the call, and thank you to Jennifer and Quintara for hosting me.